Hi and welcome back to my channel. It's Carrie the Chemist here, and I just want to introduce a new thing to my channel, and I'm just gonna use quotes to start my videos. And today's quote is, "I am wise because I learn from mistakes." So again, I am wise because I learn from mistakes. Today I am going to discuss gonorrhea, which is a sexually transmitted infection, and I'm taking the opportunity as a pharmacist to reach out to young people and people who are sexually active who might not have the information or do not read about these conditions, but it is a common sexually transmitted infection. And in my line of work, I have seen patients who have come in for treatment, and it's usually young people. So I hope that people young and old will find benefit from watching this video, so continue to watch it. So gonorrhea is a sexually transmitted infection. It's also called clap or drip. So it's highly contagious, and it's a sexually transmitted infection. It is caused by a bacteria called Neisseria Gonorrhea. It can be treated with antibiotics, and some of the symptoms include a thick white, yellow, green discharge. It can cause painful urination, especially in men. It can cause increased urination. So those are some of the symptoms that I'm referring to. It can cause sore throat. It can cause severe lower abdominal pain. This would be more common in women. Some men with gonorrhea may have no symptoms, and most women do not have any symptoms at all. Symptoms may be mild and can be mistaken for bladder or vaginal infection. So there's a picture that is depicted on this video, and it shows you the discharge that's coming from the penis. Statistics have shown, so for the States and for Canada, the CDC estimates 1 in 5 people in the US had an STI on a given day. This is in a day, right? So for every 1 in 5 people that you see walking around, they may have a sexually transmitted infection. Almost half of new STI cases were among young youths. So youths who are sexually active between the ages of 15 to 24 were the most common cases of people who had sexually transmitted infection. Stats Canada also reported that gonorrhea was highly contagious in this same age group. So based on those statistics, it's more common in the age group 15 to 25. Gonorrhea can be treated, and you'll go to your doctor if you have any of the symptoms that I mentioned above, and it can be treated with antibiotics. Your doctor will give you an antibiotic injection in the muscle, or they can give you oral medication. It's important to take the medication as instructed, and do not share the medication. All sexual partners should be contacted and get their own treatment for gonorrhea. Medication will treat the infection, but it cannot repair any damage caused by the infection. So if you have gonorrhea, complications can be sterility in both male and female. So it's important to get gonorrhea symptoms treated as soon as you notice these. Antibiotic resistance to gonorrhea treatment is increasing. So So sometimes the treatment will not work. So if you receive antibiotics and you took them according to the instruction and the symptoms continue for more than a few days after treatment, go back to the doctor to be re-evaluated. Reinfection is common, and it's important to complete your treatment and wait for at least 7 days before you engage in any more sexual activity, and use a condom to minimize risk of transmitting or getting infection again. How to prevent an STI? So in my line of work, I see a lot of young people being on oral contraceptive. Oral contraceptive does not prevent STIs such as gonorrhea. It's only prevented by using a latex condom every time you have sexual intercourse. So whether it's oral intercourse, vaginal intercourse, anal sex, always use a latex condom properly and in every sexual encounter. Being with a faithful partner also helps to reduce the incidence of STIs such as gonorrhea. If you are pregnant and if you have symptoms of gonorrhea, it's important to speak to your doctor so that you can get tested and get treatment as soon as possible for any STIs, including gonorrhea. And this will reduce any health complications for the baby. So there's a picture of the baby that gonorrhea transmitted from the mother to the child. So this is just a brief review of gonorrhea, its treatment, and how to prevent it. I hope you found this video informative. Continue to watch my videos and remember to like, comment, and subscribe. Thank you. It's Carrie the Chemist here. Thank you. Bye.